My name is Maria Prodromou. I am assistant professor in nursing department of European University of Cyprus, and specifically my specialization is the mental health and health promotion. And I am there since 2015. Previously, I used to work with drug addicted persons in government. In the past, when I was working with third age people and elderly people, the most challenging part it was the fact that I have to separate my own feelings with the decision that I should take during my practice. So sometimes, when someone was dying or was at the end stage of their life, it was too difficult for me not to carry it after the war in my personal life. So this was the most challenging part. I think caring third age people is the same like you care first age people. It's a process that is beginning from the beginning of the life. And if you have something to treat in this age, at the age of 5 years, it's as sensitive as is in the third age people. And moreover, I want to say that the third age people are more sensitive because they come slowly to the end of their life, so they feel depression, they are more close to feel lonely and have much more needs than the adults that are fully employed and organize their day in such a way that they feel active and very well done in their program. So certainly, I think the third age people are the most sensitive part of our life. I also be a project leader for a third age people program. So I have the opportunity to contact more closely to them and evaluate their needs. That's why I am more close to them. And also in the past, I used to work with third age people in a clinic. I think the most important skills that we need and abilities are the communication skills, because the way that you will contact with the person, or especially with the third age people, is the main key that will open you the road in order to intervene in a good way and you have a good result at the end. So the communication are essential, especially because those patients are not because they have a lot of problems. They are not able to communicate exactly what they want from us. So we have to have the ability to take from them their real needs. Yes, it's an essential skill. Because as I said before, is that most of the time they don't have the right way to communicate with us. So if we have this skill, we will be more sufficient in order to communicate with them and take a lot of information about them that we will be able afterwards to create their individual therapy treatment in their main needs and not according our needs, because the most important thing is to do a therapy plan with the patient that are based to their needs. I will start with the most. I like the way that I have the opportunity to communicate with people and learn about their problems, and I have the opportunity to help from little till maximum. And the most difficult, I think, part of my work is the fact that the pain, sometimes I cannot release them from the pain and from the death. So this is the most difficult part, that you have to be empowered by yourself in order to be able to give it to them in a more efficient way. I will tell them that it's very important to be to empower themselves in order to give power to other people, because if they don't have the strength and they cannot be able to manage the weak point of their position, then they won't be able to give power and push people and motivate, especially the people that are in third age, because the motivation is less in this period. So they have to be motivated by themselves, not to motivate those people that are really need this motivation during this age.